Good afternoon, everyone. My name is Jerome Bailey, and I'm with the ESRD National Coordinating Center. Thank you for joining us today for the ESRD NCC Patient Education Webinar event. The ESRD NCC webinar events are held in partnership with the Centers for Medicare and Medicaid Services. The calls feature patients and professional subject matter experts from around the country sharing how they or their organization are coping with situations related to COVID-19. Before we get started, I wanted to let you know this call is being recorded and will be posted to the NCC COVID webpage, usually within 3 business days. Many times we will have the recording up on the webpage well before 3 business days. Let's take a look at the agenda for today's call. Today we are happy to have Dexter Rogers, a dialysis patient, Brianna Smith with ESRD Networks 16 and 18, and Catina Strode with Olympic Peninsula Kidney Center. Our topic for today's call is screening for COVID-19, why your responses are important. So, what is this call about? We'll give you tips for overcoming COVID-19 screening fatigue. We hope to help identify patients' potential exposure to COVID-19, and we'll discuss how to improve responses and engagement with COVID-19 screening. Before we start our presentation, we want to share a new resource with you, tips to help boost your physical and mental health during COVID-19 was developed by patients for patients and offers 10 practical tips for coping in this environment. You can find this resource and others at kidneycovidinfocenter.com. This webpage offers a variety of information, including handouts, webinars, videos, and links to trustworthy organizations. So let's begin with our presentation. As our panelists go through their presentation and you have questions, please submit them using the chat feature through WebEx or the Q&A on the lower right of your screen. When we get to the question and answer section of this presentation, we will share the questions we have received with our speakers. Our goal is to answer as many questions as time allows. So let's learn a little bit more about our speakers. First, we have Dexter Rogers, who's a retired teacher in St. Petersburg, Florida. Mr. Rogers taught 9th and 12th grade English for 21 years. Prior to his teaching career, he played professional volleyball for 6 years for the USA national team. He also played professionally in Italy and Saudi Arabia. Mr. Rogers was a part of the 1996 USA men's Olympic volleyball team in Atlanta, Georgia. He was diagnosed with kidney failure in 2019. He is an in-center hemodialysis patient, and in his spare time, he coaches club volleyball, which travels around the country. We will first begin with our 2 professional speakers. First, Brianna Smith. She is the Quality Improvement Coordinator for the ESRD Networks 16 and 18. She is a certified professional in healthcare quality with over 10 years of clinical experience. She has worked in a variety of different scopes of practice in various clinical settings. Throughout her career, she has leveraged her diverse clinical expertise, knowledge of risk management, and passion for patient safety to guide organizations to use a team-based, patient-centric approach to improve healthcare quality for patients across the healthcare continuum. We are also going to start with Catina Strode. She served as Director of Clinical Services for Olympic Peninsula Kidney Center. Prior to her role at OPKC, she worked for DaVita Dialysis as a facility administrator. Catina has worked in the dialysis profession for 14 years and enjoys working with ESRD patients. Brianna and Catina, welcome to the call, and thank you for joining us.
Thank you very much. Catina, would you like to start?
Yes, thank you. Next slide. Thank you. Okay. Why are the COVID-19 screening questions important? Dialysis patients are immunocompromised. So since dialysis patients' immune systems are compromised, we must do our part to limit their risk of exposure. The questions help decrease the spread of coronavirus and preserve the overall health of all patients via screening. Through proper assessments, screening questions can detect infection early. Screening could also assist in timely treatment to treat symptoms early on to limit potential complications in the future. Screening can help you and your family stay safe from potential exposures. If everyone is properly screened, we can help identify patients who may need to be cohorted in different locations for dialysis and essentially mitigate potential risk of exposures. This can help eradicate the virus and helps us return to normal much sooner. Next slide. Okay. What do dialysis centers staff help to accomplish by asking the COVID-19 screening questions? Well, we hope to identify a patient's potential exposure to COVID-19 and identify if a patient needs to be treated in a COVID-19 isolation clinic or in the COVID-19 isolation shift throughout the day. We can identify risk of exposure outside of dialysis units. For example, patients that are residing in a nursing home or extended care facility. And we can educate patients about safe visitor practices, especially during the holidays, and then offer tips to help with mental support and coping with stress. Next slide, please. Okay. What type of questions are patients asked during the screening? We typically ask, are you experiencing flu-like symptoms, such as a fever, cough, chills, body aches, loss of sense of taste or smell? Have you been exposed to someone who has tested positive recently? As the CDC defines exposure as close contact closer than 6 feet or potential exposure in small increments with an infected person that are less than 15 minutes in length. So we like to remind patients that COVID-19 cases are continually increasing, and it is important to be honest to mitigate the spread of the virus. Next slide, please. What is screening fatigue? Screening fatigue is a response that may occur when the same questions are asked repeatedly over a long period of time. The screening questions begin to lose their value when patients aren't answering them accurately. So this can impact our staff and patients and create risk within our facilities. This may also lead individuals to answer without being thoughtful with their responses. So patients should continue to answer the questions as accurate as possible to help us to better triage patients early on in the treatment. Next slide, please. Why is it important for patients to answer the questions accurately? Well, your actions impact others. Just think about how drunk drivers place the public at risk when he or she believes that it is safe to drive and consume alcohol. Well, these drivers aren't taking into consideration the harm that they may cause others if they are driving recklessly and they cause a collision. So similar to this, those people that are out in the public without wearing their mask, they're placing the public at risk of exposure. So you will want to continue to protect yourself and others because your actions do have consequences that may negatively impact others. So then you'll ask, how can we improve the screening process? Next slide, please.
Thank you, Catina. This is Brianna. I'm going to continue with the slides. To improve the screening process, the process itself of screening for COVID-19, it can be complicated by the barriers that are meant to protect us if they don't work. So to understand how barriers fail us, I'd like to take a moment to refresh everyone's memory on James Reason's theory of accident causation. We're getting a little lesson here in patient safety. This theory is used in risk analysis and risk management as a principle behind layered security. It likens human systems to multiple slices of cheese. And in this case, in the case of COVID-19, the slices of cheese represent different layers of defense against infection, such as, your friends and family wearing PPE, masks, good hand hygiene, social distancing, our own individual behaviors to adhere to the guidelines, CDC guidelines. Also, defense layer being good screening and accurate answers to the screening questions. When holes in the cheese, they represent the weaknesses in individual parts of the system or individual layers of defense. When these holes happen to line up, in the case of COVID-19, the infection is allowed to pass through. And so with each subsequent layer, if each hole lines up, then those layers of protection are not effective. So over the last several months, the networks have been conducting one-on-one COVID technical assistance calls with dialysis providers from across the country. And in those calls, we have identified many ways in which our defenses are not as effective as they could be. For example, we've identified that many patients are becoming exposed to the virus from the individual behaviors of others. In particular, they're being exposed by their friends and families. This is a result of lifestyles, work environments, or non-adherence to guidelines such as wearing masks or social distancing. By identifying that friends and families have been the leading cause of infection, this allows us to take a deeper look at what we can do to better protect ourselves and close those holes, so to speak. Also, when we've identified that when individual patients do not adhere to the appropriate precautions, they expose themselves further to risk of infection and also expose those around them to the risk of infection because they aren't adhering to the guidelines. And as you can see, when one layer doesn't work and then the next layer doesn't work, the virus continues to proceed. Screening questions are supposed to correctly identify changes in patient condition or potential exposure to the virus. However, if screening questions are too generic, they don't ask about potential exposure from others, or they don't differentiate between a patient's normal ESRD symptoms and the symptoms of COVID-19, then the risk of infection increases. Even if screening questions are asked correctly, if they are not answered accurately and response is given appropriate follow-up, then the virus could spread throughout the clinic and throughout the community. Staff and patients must remain diligent in their level of participation and engagement with the screening process in order for the screening process to be effective. This means updating the screening process as the pandemic continues so that it continues to be impactful and effective. With that, it's time to refocus our efforts, go back to the drawing board, and improve our layers of defense by incorporating best practices we have learned throughout the last several months into a new screening process. Next slide, please. So recently, the networks examined the differences in the current screening practices used by various dialysis organizations. We found many similarities and a few differences. In general, most of the screening questions are way too generic. They're meant for the general public. They are often not available in a patient's primary language, such as Spanish or Farsi, and need to be made more patient-centric. What do I mean by patient-centric? I mean by really thinking differently about how that patient lives. We know that a patient that's bedbound isn't going to be traveling a lot. but one that is younger, healthier, and works may travel. So we may want to consider asking them some travel-related questions. In the highlighted document to your left, we have outlined some tips for providers to improve their screening process. Recommendations include identifying potential exposure to the virus by using what they know about their patients and their normal ESRD symptoms in a more strategic manner. For example, this guidance encourages providers to utilize a patient's average body temperature to better identify if a patient has a fever. Providers are also encouraged to revise their screening questions to ask about potential exposure to COVID-19 outside of dialysis. Now, some of these questions outside of dialysis may seem a little intrusive, especially if they ask about home or work, but this information is incredibly helpful for clinic staff to protect patients and themselves, especially as the virus spreads as it has been over the last several weeks. In many of the network COVID technical assistance calls, many patients were exposed to the virus from people who do not show any symptoms of being sick. Well, that's an important point. We need to revise our screening processes to better identify those patients who may be sick but not showing any symptoms. And by understanding where those people work, or if those people happen to live with dialysis patients, providers can better help patients to implement individual strategies to better protect themselves. In an earlier slide, Catina mentioned that many patients can be hesitant to answering screening questions accurately because they are fearful of going to a COVID-19 isolation clinic. Some are also hesitant because the change in treatment location could cause additional hardships for their lives outside of dialysis. In this resource, it is recommended that dialysis providers use screening as a time to identify fears and address concerns patients may have and work together to develop a just-in-case plan if they need to either be treated at one of these isolation clinics or on an isolation shift. If improving the screening process can be made more valuable, then we can all better protect ourselves and those that we love. Next slide, please. For the current screening process, we identified that it doesn't easily identify these asymptomatic cases, or to put it another way, it does not identify those cases where people have the virus but are not showing signs of being sick, such as a fever or a cough. One strategy to overcome this gap is for patients and providers to become aware of outbreaks in their local communities before they go out or before allowing visitors. The map to your right shows us which locations in North Glen, Colorado are currently experiencing outbreaks. In this map, we see there are a few schools, a factory, and a restaurant experiencing an outbreak. In this particular map, allows the viewer to select the icon, and a pop-up will show more details about the event, such as how old it is, the number of cases, etc. Many local health departments are publishing their COVID-19 outbreak data online in either a map form or a list form. And by making the locations of outbreaks public, communities can better understand if they may have been community members, and the communities themselves can better understand if they've been exposed by someone who works at these locations, or whether those people are showing any signs of being sick. If we know where the outbreaks are, we can better identify exposure to people that maybe aren't sick. To learn more about these locations in your community, I recommend contacting your state, your county, or your city health department, as many of them are placing this information in different locations. So it may be hard to find, but certainly we want to help you, so if you would like more assistance, please feel free to reach out. When we can better identify the potential for exposure, we can take steps to mitigate our risks and respond to fears or concerns. For example, I might not go eat at that restaurant just to the north of North Glen, near Highway 25. I may choose to go somewhere else. Or if I know that the school is having an outbreak and my son happens to be at that school, I may not want him to come home to visit for Thanksgiving. I may put him up in a hotel and send him a care package. This is one way that we can keep ourselves safe. Next slide, please. So earlier we also learned that many patients are hesitant to answer screening questions accurately due to fear and as a result of just being fatigued, being answered the same question over and over again. More specifically, many patients have reported being afraid of just going to the COVID-19 clinic because they are afraid of the stigma that comes with being placed in isolation or quarantine. Many of them don't want their schedule to change if they have to be put in an isolation clinic or moved to an isolation shift. And some patients are also afraid of being denied treatment the day they answer yes to any symptoms. This is understandable. And in these crazy times, it's important to manage our fears by examining the facts and asking for help. By finding ways we can have some control of our situation, we can often feel less afraid. The networks asked their patient subject matter experts recently to provide some advice to patients who may be afraid or concerned about impacts they might have with going to a COVID isolation clinic or shift. They recommended that every patient understand what safety measures are in place to help keep patients safe, and if they must receive treatment at any of these clinics. Next slide. So a great place to start understanding how dialysis clinics are keeping patients safe is by reviewing the current CDC guidance that's available. Seen here are a few examples of that guidance and that explain the many strategies that are in place at your regular clinic and at a COVID-19 isolation clinic. Some clinics are treating patients suspected of having COVID-19 or those that have been tested or are found to be positive are treating them on the last shift of the day. Well, this is so that there is enough time for cleaning and disinfection to occur before the next day's shift begins. Staff at these clinics have also been provided additional training on infection prevention. And these clinics and shifts have also increased monitoring of staff adherence to proper infection prevention protocols, such as hand hygiene. They have also implemented different processes, such as entering through a separate doorway or having partitions placed around certain dialysis machines so that they have separation between healthy patients and patients awaiting test results. So to ease your fears, our patient subject matter experts have recommended that we just reach out and ask for more information from our providers. They say it's the ones that have been to a COVID-19 isolation clinic, they've reported that it's just like their regular dialysis clinic, but with patients sitting further apart and the staff are wearing more protective equipment. They're just the same friendly staff that you would have at your normal clinic or your normal shift, just wearing different outfits. Our patient subject matter experts really recommend asking your provider or care team to explain these different cleaning practices found in the guidance from the CDC and then those also used at the local COVID-19 isolation clinic. And if there's anything you don't understand, to let them know. Next slide, please. Some more advice from your peers is to become as prepared as you can, such as they recommend developing a just-in-case action plan with your care team to address what might happen if you do become sick. Something to think about is transportation. Ask your provider about what transportation arrangements might need to be made so that you can get to an isolation clinic or get to an isolation shift at the end of the day on time. If you have to travel to a COVID isolation clinic and it becomes a hardship, you may want to talk to your provider about that. If you're concerned about schedule changes or because of the distance that you may need to travel, that is also something that you would want to discuss. Maybe ask them if there's alternative appointment times or locations that might be available that could work better for you and your family. Some transportation companies have been asking for a doctor's note once patients have become healthy again so that they can use their transportation services. In that case, I would plan in advance to see if that's something that you might need. We certainly want to make sure that you don't miss any treatments as a result of needing a doctor's note. Your peers also recommended developing a plan on how to stay safe if someone you live with becomes sick. Can you properly isolate at home? Many people live in small apartments with large families. Could you or a loved one stay in a hotel or with a friend who has more room to isolate? In some parts of the country, some families are using their campers or RVs as a temporary shelter for this type of situation. Others have converted a shed as a temporary place to isolate. One clinic we spoke with is helping people get a hotel room. In many areas of the country, local governments have vouchers available for people who wish to isolate themselves if they're sick or could potentially be exposed by someone they live with who is sick. I recommend asking your social worker about some of these programs. They're often found through the Red Cross or other community programs. You may need to plan for someone to take care of your kids, or if you are caring for elderly, someone's got to make sure they get fed and are not getting into trouble or are taking their medications on time if they're older. If you're not able to help them, you'll need someone to back you up. Some communities have local individuals that step up and help with these kinds of things. You may want to ask a social worker or reach out to a community group to determine if this is something that might work for you. And you certainly also want to consider reaching out to your faith-based organizations to see if they have some programs in place for, to help support with child care or elder care should you need it. Many of them also are offering some transportation support. By having a plan ready, we can face our fears as a team and feel more prepared for some of the unknown scenarios that might occur as this pandemic continues. Next slide, please. So to summarize, it is important to follow recommended precautions even if we don't like them, because understanding that improper use of precautions by yourself and those around you is a lot like drunk driving. Our individual actions and behaviors do impact the lives of others, especially since we don't see this virus. It's hard to keep track of our impacts. So do your best to stay informed of locations of local outbreaks, adhere to those precautions, identify if those closest to you work in environments that are high risk, such as at a school, a hospital, or a nursing home, or anywhere there's a lot of exposure to the public. You really also want to be a self-advocate at home and everywhere else. Many of you have been limiting visitors or asking those that you live with who work in high-risk jobs to be extra cautious. Some patients have put up signs on their front door reminding people to wear a mask, wash hands, and practice social distancing if they choose to visit. Some patients are completely avoiding attending in-person events, especially those indoors and also those outdoors that may be crowded. You certainly also want to speak up to your family, friends, to your care team, if you have any concerns or fears. There's a lot of unknowns, and the more questions we ask, the easier it is for us to know what it is that we can do to help you. If you don't understand something or you need information in your primary language, if English is a second language for you, please ask. There are many organizations out there that have taken the time to translate a lot of this guidance and information into the various languages that we have in this country. Next slide, please. And finally, work with your care team and loved ones to develop a plan if you or those living with you do get sick. Understand what changes to your treatment location or schedule might need to be made, and if you need to be treated as an isolation clinic, and what actions you need to take to address those changes. Educate your friends and family about ESRD and how that places you at greater risk of contracting the disease. Reinforce to everyone around you that proper use of precautions keeps you healthier and helps protect others by reducing the spread of the virus. Lastly, this pandemic is incredibly difficult to endure. It's isolating, it's stressful, and so it's important to reach out for support. Join a virtual support group. Ask for mental health support. Engage your peers. Ask questions. You could even try to pass the time in positive ways, any positive way you can, by encouraging others around you. Maybe even write a letter or call someone on the phone you haven't spoken to in a long time. It's important, though, to remain diligent, to coach and support each other, to stay focused, and to work together to combat this virus. And with that, I'd like to thank everyone for joining us, and I'm going to turn it back over to Jerome to share with us our patient's perspective.
Thank you, Brianna. Thank you, Catina. Lots of great information in your presentation. And as Brianna said, we are now going to turn it over, the conversation over to Dexter Rogers, who is a in-center hemodialysis patient in St. Petersburg, Florida. So, Dexter, are you with us?
I am.
All right.
Can you hear me?
Thank you. Yep, I can hear you. We can hear you. What was it like to be diagnosed with COVID-19?
Well, I was diagnosed August 4th, and I was shocked, actually, and I didn't know what to do because I just didn't feel right, and I didn't feel well that morning, and I always feel good. And I woke up, and I said, Terry, I don't feel great, and we went down to the hospital, and they told me that I had COVID-19, and I immediately panicked because I am, of course, a hemodialysis patient, and they said that it could kill me. But I wasn't having a hard time breathing. I was just tired. You know, I still had an appetite. My taste was still there. My sense of smell was still there. But frankly, and once I kind of, the doctor kind of talked to me, and I called my friend Bill, who is a nurse, and we talked about all the different things that could possibly happen. He just said, for me to, keep my wits about me, stay as active as I can, walk. I was in the hospital for 3 days, but I would get up and walk around my hospital room. I just didn't want to feel like I was giving up, so I couldn't sit still because I'd heard that, everyone who was sitting still actually was getting sicker by the day. So I found a way to just try to stay active in any way that I could.
Now, once you got out of the hospital, did you have to go to a COVID dialysis facility?
Yes. So the facility where I get dialysis is about a half hour away from my house. But the facility where I had to go get dialysis when I was diagnosed with COVID was an hour and 15 minutes away from my house. So it was quite a drive, and it was early in the morning. I had to leave my house at 6:45 to be there at 8:15. So that was interesting because early in the morning, I'm not really good at those sort of things. So I had to sort of try and make myself better at, getting up and getting ready, because I had to go to that clinic for 2 weeks. And then after 2 weeks, they gave me one COVID test at the clinic. And then I had to get a COVID test on my own for me to return to my other dialysis clinic.
Now, was there an explanation as to why you were being sent to the other center? Did your home center do a good job of explaining to you why?
Yes. So when I am with, I get my dialysis at Fresenius, and what they do is they have set clinics in each city that they send their dialysis or their COVID patients to. So at my home clinic, no one can come there. If they have COVID, you can't go there. You have to go to the one that's an hour and a half away, hour and 15 minutes away. So before this even started, they had said, well, this clinic is going to be the designated clinic for non-COVID patients, but that clinic will be the designated patient for positive COVID patients. Same thing here in St. Pete. The one that I used to go to here, that's a primary clinic for COVID patients, and then there's another one downtown they don't allow COVID patients. So whatever company that you do your dialysis with, they designate specific clinics for those patients.
Can you talk about other safety measures your center has taken to keep patients safe during this time?
Yes, of course. So once I walk in, they take my temperature. After they take my temperature, they ask me a series of 5 questions. Have you been exposed to COVID? Do you know anyone who has COVID? Do you have you had a temperature in the last 48 hours, a cough, a fever? They ask all those questions, and they immediately hand me a mask. And once you walk in and get checked in, they do the fever, or they do a temperature check, and you have to have that mask on from the time you walk into the clinic until the time you walk out.
Now, you just talked about the screening questions. Do you, or you can even talk about what you think of other patients? Do you pay attention to those questions, those screening questions, or are they automatic responses for you? Before I got sick, there were automatic responses. And then since I've been sick, I pay very close attention to everything, how I'm feeling, if who I expose myself to, all those things. So now I pay much closer attention. Before I thought, it won't happen to me. And of course it did. So, and like I said, if it happened to me, it can happen to anyone, because I don't spend a lot of time with a lot of different people outside of, my circle, let's say. So I was very surprised. But do you think other patients are the same way as you were, in terms of the responses are automatic to the screening questions? Yeah, I think a lot of people are automatic with those answers until someone that they love, or possibly the individual, gets sick. Then all of a sudden the perspective changes. Because it's like sometimes regardless of the precautions that you take, sometimes you just happen to be the one that gets sick, and then all of a sudden, like I said, your perspective changes. Any advice on what dialysis facility staff can do to ensure patients are engaged during those COVID-19 screenings? Yeah, I think a lot of the staff at those clinics, they can, ask more probing questions about, because a lot of people, if they feel like they're really, the people at those clinics really care about them, then they're open to answer questions openly and honestly. But if they feel like they're just asking them just because it's their job, they're not really going to be forthcoming with answers. So it's, in your words, it's up to the facility staff to engage patients in more than just, you know, their direct care. So
Right.
asking about family, asking about, you know, things they like to do outside of the facility.
Right. You know, and because a lot of times what I've noticed is a lot of, in those situations, a lot of dialysis patients, they're lonely, you know, because they feel like, well, this could have killed me, and, you know, what about this? You know, they're constantly questioning things, and sometimes some of the staff at some of the clinics are very engaging, and other times they're just there to do their job. It's like they don't have a heart, you know, like they're not really there to ask questions or have conversation. They're just there.
Well, Dexter, thank you very much. I'm going to ask you to hang on for a little bit.
Okay.
We now want to hear questions from our audience. If you haven't already done so, submit any questions you might have for our panelists using the chat feature or the Q&A icon through WebEx. We did get a couple of questions earlier, and so I'm going to throw this out to our panelists. What if a patient is diagnosed with COVID-19 but is asked to go to a dialysis facility that is far from their home, similar to what Dex went through, and does not have the means to get to another facility? What happens then? So, Brianna or Catina?
Hi, Jerome. This is Brianna. I can answer from what I have heard other dialysis providers doing. And in this type of situation, they have made an interim COVID-19 shift for those particular patients. For example, if in the example that I'm recalling, the clinic is in a very remote area of the country, and the patient also lived very remotely. So having, you know, to drive 200 miles away was not realistic. It created a whole bunch of hardships. So they worked together as a team. The healthcare team themselves got additional education and support, and they opened up an evening shift just for that one patient until they recovered.
Huh. Thank you, Brianna, for that response. Another question that came in, again, I believe this is directed towards Brianna or Catina. Should I say something to a staff member if I feel another patient isn't being honest with their screening question answers?
Brianna, do you want me to answer that one?
Yeah, I think that your perspective as a provider might be really beneficial.
Okay, so you think that the patient isn't answering the questions. My question would be, why do you think the patient isn't being truthful with the responses?
Yeah, that I would have to ask for that person who sent in the question to send in a follow-up question or a response.
Yeah, definitely. If you feel like the patients aren't being truthful in their responses, I would investigate that myself. I would contact the charge nurse to have the charge nurse do a thorough assessment with the patient and ask the patient if they're being truthful with the questions, and maybe be more thoughtful in the way that you ask the questions. Because since the patients are having the survey fatigue, I would maybe verbalize or ask the question in a different manner, so it's not as direct, like ask open-ended questions to get the patient to open up and offer more information.
Right.
Okay. Just reword the question, maybe.
Yes.
We got a question for Dexter.
Okay.
Many patients report feeling very tired after their treatment. Did you have any issues with driving home after your treatment since you were asked to go to a facility that was far from your home?
Yes, as a matter of fact. So I thought it had it before COVID. I thought I had my treatment pretty much lit, because I would go and practice and do whatever afterwards. But then once I contracted COVID, I remember driving home one day, and my partner Terry actually came out in the driveway, and I was asleep in my car. I don't know how I made it home, but I did, thankfully. But I was exhausted. It was like I couldn't sleep enough, and I don't remember pulling out the pulling in the driveway or anything. I just remember him waking me up.
Wow. Another question we have for Brianna and Catina. With the holidays, I have heard of a lot of suggestions for staying safe. Is it recommended kidney patients not travel this season? Should we share our holiday plans with our dialysis facility?
This is Brianna again. I think it would be very helpful to share holiday plans with the dialysis facility. That way, if there's any potential risk of exposure, they can act accordingly to protect themselves and to protect other patients. We certainly want everyone to adhere to guidelines, but knowing that people miss their family and want to engage in this holiday, really try to take steps to minimize travel, be outdoors as much as possible, staying distant. We had one recommendation: instead of doing a turkey, a family was going to do Cornish game hens, so they didn't have to pass the bird around. I think that's an excellent idea, something to kind of think about with the meal planning is how can you limit the passing of dishes, which could lead to the passing of germs. You could do a picnic style where you're all spread out, if that's possible. But yeah, certainly limiting travel is a good thing to do right now with the infection rates as they are so very high across the country.
Thank you for that. Yeah.
To add to what Brianna said, I would also encourage the patients to notify the facility and the facility to the patient upon return from travel, but also to be mindful when you're gathering around food. Like maybe one person go up to a dish to obtain their food at a separate time, so everyone's not gathering around dishes at the same time, and still try to social distance the utensils, change out the utensils, and sanitize those frequently after others have touched them, and continue to do environmental disinfection in the home, cleaning down surfaces and disinfecting between people sitting at the table and things like that. I would take those things into consideration as well.
Okay. Another question for Dexter. What was your experience like dialyzing at a COVID facility?
It wasn't much different, actually, because at the other facility there was one nurse that I'd seen before, but it was actually, well, I shouldn't say that. That's not true. It was much more isolating because there were, at my other clinic, there were, I think, 30 chairs. And at this specific clinic, there were only 10, but there were only 2 were being used. So it was very isolating.
Okay. For all the participants on the call, if you have a question for our panelists, don't hesitate to send in the question using the chat feature on WebEx or the Q&A feature on WebEx. And this may be our last question, and it's for Dex. What advice does Dex have for fellow patients when answering the screening questions and for coping in this COVID environment in general. So any general advice?
Yeah, I think the biggest thing is attitude is everything. You know, because even when you wake up and you don't feel great, you can convince yourself that you're in a good mood or that you feel better than you actually do. And you got to make it through the day, because sometimes when you wake up and you're frustrated because you're a dialysis patient, you got to go and get stuck in the arm and you got to sit there for 4 hours. It can be overwhelming, but you got to kind of check yourself every day to make sure that, you know, you are taking the day on with a good attitude and going to make the best of it, because, you know, the alternative could be a lot worse. So just kind of keep your attitude in check.
All right. And Dex, before you go, we have another question that just snuck in.
Okay.
Are you still having the same issues with driving?
No, just that week or 2 weeks when I was had COVID. You know, I'm fine. You know, I actually get energized after I get done with dialysis, and so, you know, like some people say they get drained. It's like I have more energy now. So no, I don't have those issues at all anymore.
All right. Well, Dexter, Brianna, and Catina, thank you all very much for all the great information. We definitely appreciate you sharing your experiences and expertise.
Oh, thanks for having me.
Thank you for having us.
Thank you.
No problem. So, you're welcome. Next slide, Matt. So throughout the calls, our speakers have been talking about overcoming COVID-19 screening fatigue. ESRD Networks 7, 13, 16, 17, and 18 created the Tips to Overcoming COVID-19 Screening Fatigue tool for healthcare professionals. The resource was developed to help engage patients through the COVID-19 screening process. You can find the resource by visiting kidneycovidinfocenter.com and clicking on the professional icon. A patient resource will be available for download before the end of the week. Next slide. As a reminder, the NCC website offers a web page with information for patients or family members. The resources available on this page would be appropriate for someone new to kidney disease, someone who is thinking about changing their treatment options, or learning more about their current treatment. The resources provide information about what to expect if you have recently been diagnosed with kidney disease and need to consider dialysis or transplantation. It discusses choosing transplant or home dialysis, infection prevention, emergency planning, and there is a section for caregiving. Please visit esrdncc.org/patients. Next slide. For additional COVID resources, visit the ESRD website resources. The web page has lots of great information, from where to find credible online information to ways to empower yourself to learning how to connect virtually with others. The COVID-19 Patient Resources webpage offers a variety of information. You can access handouts, webinars, videos, and links to trustworthy organizations. Check back often because new resources are added frequently. And next slide. So we want to tell you about the Kidney Patient Care, Your Guide to Using Telemedicine. This toolkit was created to support the patient transition to telemedicine during the COVID-19 pandemic. It includes information about the benefits of using telemedicine, how patients can start using it, and the equipment needed to get started. The guide even shows patients how they can track their healthcare appointments. And next slide. For our final resource, we want to remind everyone about the kidneyhub.org. It's a mobile-friendly web app developed by the NCC with lots of input from our patient subject matter experts. It has information on home dialysis, the kidney transplant process, infection prevention, mental health, and more. I have it saved to the home screen of my iPhone, and it makes it extremely easy to access useful information. Check it out today. And as a reminder, our patient COVID-19 webinar events are every other week. So our next patient event is Tuesday, December 1st at 4 p.m. And the next professional COVID-19 call is next Tuesday, November 24th at 3 p.m. That's a new time. Those calls are usually on Wednesday, but because of the holiday, we moved it up to date. Thank you all again for being with us this afternoon. For additional COVID-19 resources, visit the CASER website at casercoalition.com. Thank you, everyone. Have a good evening.